Morning everyone, Dr. Brian Steiner here at Wilkins Spinal Care. Just as in a video I posted on Friday, I believe, I talked about how we're changing the format of our videos and we're dropping the Research That Matters TV. The reason why we dropped that was because we have such a high supply and a high demand for new patients and new users on our Facebook page. And a lot of these patients have never been to a chiropractor before. They don't even know what chiropractic is. So I'm starting back from square one, and we're going to introduce chiropractic care. We're going to talk about some other things before we actually start getting into conditions like back pain, neck pain, things like that. And we're going to spend the next couple weeks kind of talking about those things, as well as kind of talking about how we run things in our office, so that when patients come in here for the first time, they'll have somewhat of an idea what we're going to be doing with them. So let's start with today's topic, which is just what is chiropractic care. So a chiropractor, the chiropractic term means in Greek, done by hand. So chiropractors adjust using their hands. We don't use any sort of medication at all whatsoever. So essentially what the chiropractic definition is, it is a alternative type of medicine that is done by providing a spinal manipulation or an adjustment to the neck or back region. So people tend to ask, are you a back and neck doctor? Yes, we are a back and neck doctor, but essentially I like to think of it more as we are a nervous system doctor. Now let me explain to you why we are a nervous system doctor. Here you have your spine. The spine is a protective layer for the nervous system. Within the spine you have the spinal cord and you have the brain that sits up here. The nervous system controls everything that we do. It allows us to walk, talk, breathe, allows us to see, hear, smell, all our senses. It controls all the organs inside our body. So what happens is what we're essentially doing, we're addressing the back and the neck, which is essentially affecting the nervous system. If you look here, you have these little holes. What those holes are is a pass-through for these yellow things right here. Those are your nerves. Again, these are what allow us to do everything inside our body. What essentially happens within the spine is that these bones move out of place. And when those bones move out of place, it puts a narrowing on that hole and it essentially entraps that nerve. That's when we start to see pain. That's when we start to see symptoms down the legs or down the arms for that matter. Our job as a chiropractor, my job, is to move these bones back into place, taking pressure off of that nerve. So will this take one visit? A lot of patients will see a remarkable change within one visit. But it just depends on how long you've been in that position for. If you've been in it for 5 years, don't expect to see a change in 1 or 2 visits. It's going to take some time. Will it take 5 years? Probably not, but it will just take a little bit more time than it would for someone who's only been in pain for a day or a week or such. So that's kind of what we're doing. So now people tend to ask, are we only treating back and neck pain, symptoms down the arms, down the legs? No. Again, the nervous system controls everything that happens in our body. Chiropractors treat numerous conditions. Back pain, neck pain, fibromyalgia patients are a good candidate for this. Headaches, asthma. People like asthma, you're not a respiratory doctor. No, we're not. But again, the nervous system controls all the organs in our body. Now, can chiropractors treat every single condition? No. Take cancer, for example. Can we help with immune function? Absolutely, because the immune system is controlled by the nervous system. Can we eliminate a tumor? No. So obviously, our job here is when we first have you come into our office, we're basically saying to you, we're going to help you to the best of our ability. If we can't help you, we will find someone for you. Obviously, in a situation like cancer, we're not going to eliminate that tumor. That's an oncologist's job, and we know that. We know our boundaries, but we'll at least get you adjusted to keep that immune system going. But again, we address all these different types of conditions. Now, can everyone be under chiropractic care? Absolutely. Not a problem at all. We've seen patients from newborns all the way to 99 plus. Everyone has a nervous system, and everyone can benefit from the chiropractic care because that nervous system is allowing us to do everything that we need to do. And in order for that nervous system to allow us to do all the things that we need to do. We need to make sure it's up to its maximal function, and that's where chiropractic care comes in to help make that maximal function happen. But that is all I have for you guys today. It was a little bit more than usual. Next week, what we're going to talk about is we're going to deal more with the nervous system, kind of give you guys a little bit more understanding of the nervous system before we start moving into things like how our offices run, patient care, patient communication, things like that. I do have some sources for you, and just like I did with previous videos, I will post them at the bottom of our comment section, and you guys can feel free to share this, like this with as many people as you can. We want to make sure we get a big, a big spread of people that want that chiropractic care because they can benefit from it greatly. But that is all I have for you guys today. Have a great day, and I will see you guys next week for another video.